So the doctor has ordered the patient to get Flagyl in their IV to an antibiotic to help with any infection. I've already checked my MAR for their white blood cell count, their bun, and their creatinine levels. They all seem to be okay for the patient to go ahead and receive this medication. So I've already gathered up all of my equipment that I'll need for this procedure, and I'll go ahead and start by drawing up my medication. He ordered 500 milligrams of Flagyl. This bottle comes 500 milligrams per 1 milliliter, so I'm going to drop 1 ml. Go ahead and clean off my bottle. 1 ml. Okay.
Yeah, I just put yeah. You just, once you unlock it.
I'm going to go ahead and insert this into the medication bag.
Lock this back up. Like, let's say,
Discard of my needle. I'm going to go ahead and gently shake to mix the medication up. I'm going to go ahead and attach my line.
Yeah, because then it won't run. And if you do lock it, then you have to go back to 45 minutes.
And I'm going to prime it just to make sure there's no air bubbles for when I give it to the patient. I'm going to go ahead and label both the medication bag as well as the line that I'll be using with date, time, and initials on both. Alright, and then I'm going to go ahead and draw up my saline. I'm going to go ahead and get 6 mils. I'm going to go ahead and discard that needle.
Just like them, they're practicing.
And I'm ready to go to my patient's room. So I go to my patient's room, knock, knock, knock. My name is Tiffany. I'm going to be your nurse today. Your name is Mr. Jones. Can I get you to verify your name and date of birth for me? All right, wonderful. Let me go ahead and check your site to make sure everything's okay. And do you have any known allergies? No. All right, great. So the doctor has ordered an antibiotic for you, which is Flagyl. Have you ever received that before? No? All right, well, it's an antibiotic. It's going to help you with the infection that you're having. So I'm going to go ahead, perform hand hygiene, and put on my gloves.
I didn't bring my stuff. I figured there'd be some stuff.
I'm going to go ahead and hang my line. And it's already been flushed. And I'm going to go ahead and check to see if your line and your arm is still open. So I'm going to clean it first.
Yeah, I don't get, they just kind of show it like a triangle.
I'm going to aspirate. I see blood, and then I'm going to flush 3 mils slowly. Alright. Go ahead and remove that, and I'm going to go ahead and attach my line. I'm going to establish a drop factor, a flow rate, which is going to be 50 milliliters per hour, is what the doctor ordered. Alright. I'm going to check my site, checking for any infiltration, any pain, redness, or tenderness. Not available. Alright. Then I'm going to go ahead and clean up, and I'll be back once the medication has ran through. Let me first check to see if you have to potty, give you back your possessions. You had no pain, and let me go ahead and lower your bed to the lowest position possible. Then I'll go ahead and leave. Then I'll come back in an hour once your medication has run out. Again, I'll go ahead and check your name and date of birth just for verification purposes. I'm going to check your site. Again, it appears to not be red or tender or swollen. So I'm going to go ahead and clamp the medication here and unattach it and hang it back up for your next medication dose. Then I am going to go ahead and clean your site again, and I'm going to flush with saline. Flush the next 3 mils. Alright, see no problems. At this point, I will go ahead and also insert heparin in if the doctor had ordered it. Let me go ahead and recap my line. Alright, are you having any pain at the site? No? Alright, let me go ahead and lower your bed back down to the lowest possible position. Do you have to use the restroom? No. And here's your personal belongings. Then I would go back. I would document the medication, the flow rate, the administration of the medication, the site, how the patient tolerated it, and that's it.
Well, yeah, you got to the point where you want to
Okay. All right.
We are trying to pause.
Is it not pausing? Just stop it. Let me see.